Thanks for staying with us. Time now for Eye on Africa with me, Georgia Calvin-Smith. Tonight, the WHO strongly rejects the controversial suggestions made by French scientists last week that coronavirus vaccine testing should happen in Africa. Critics of the on-air remarks have slammed them for being racist and born of a damaging colonial outlook. Also, Ivorian protesters ransacked the site of an emergency coronavirus medical reception centre. Frightened locals say that they're scared that the centre would make their community more vulnerable to infection. And kids in Burkina Faso are being encouraged to watch television as school lessons are broadcast on the small screen. Children are being kept at home as schools and colleges are shut in the coronavirus fight back. But first, the head of the WHO has condemned suggestions made on air by French scientists last week that potential coronavirus vaccines should be tested in Africa. Jean-Paul Mira, head of intensive care at the Couchin Hospital in Paris, first asked if he could be provocative before questioning Camille Locht, head of research at the National Institute of Health and Medical Research in Lille, whether a study into using the BCG vaccine should happen in Africa. He compared it to past studies into AIDS that tested treatments on prostitutes. WHO Chief Tedros Adhanom Ghebreyesus was one of many who condemned the tone of the conversation as being racist.
To be honest, I was so appalled. And it was a time when I said, when we needed solidarity, this kind of racist remarks actually would not help. It goes against the solidarity. Africa cannot and will not be a testing ground for any vaccine. We will follow all the rules to test any vaccine or therapeutics all over the world using exactly the same rule. Whether it's in Europe, Africa, or wherever, we will use the same protocol, and if there is a need to be tested elsewhere, to treat human beings the same way, equally. And the hangover from a colonial mentality has to stop. And WHO will not allow this to happen.
Now, the doctors have apologised for any offence caused and say that they've been misunderstood. Africa has seen far fewer cases of COVID-19 than Europe, the United States and the Middle East. For more on the controversy sparked by the doctors' comments, I'm joined by Professor Maligapuru Makhoba, South Africa's National Health Ombudsman and a former president of its Medical Research Council. Professor Makhoba, thanks very much for speaking to us. Now, first of all, is there any reason to carry out clinical trials for treating COVID-19 in Africa currently?
There is absolutely no reason to do such studies in Africa at this particular time.
And why so?
Because, first of all, there is no epidemic yet in Africa. I think the whole of the continent has about 9,310 patients with COVID, compared to France, which has got 93,733 patients in one country. And in Africa, you are talking about 51 countries. None of them have got adequate numbers to conduct a clinical trial.
So
for that reason, it would be unethical. Yeah.
No, please continue, Doctor.
I'm listening.
No, please continue, Professor.
I'm saying it would be unethical. Yes, I say it would be unethical to conduct a clinical trial in a place where there is no disease or there is nothing to test for.
So that's the situation currently. However, testing in Africa, could it not be useful going forward in the future? I mean, the continent is preparing for a possible spike in cases. And we've even seen DR Congo's National Biological Research Institute's, the head of the National Biological Research Institute, suggesting that his country is prepared to take part in future tests. So could this position about the viability of tests of clinical trials happening in Africa in terms of trying to treat COVID-19, could your position on this change?
I've said that at this particular time, you only conduct clinical trials when you have a disease and its prevalence is enough for it to achieve scientific validity. There is no such basis at this point. Until we have that, there will be no reason to conduct clinical trials in Africa. That's why I suppose the head of the DRC said in future, because the future is unpredictable, especially with this pandemic at the moment. But as we speak, there's no basis for clinical trials.
And could you compare the approach taken in trials to find treatments for AIDS? Could you find a comparison between the approach on that front and that needing to be taken in terms of finding treatments for COVID-19?
No, you can't compare the two things. First of all, when we started clinical trials on AIDS, we had AIDS as a disease and as an epidemic in Africa. And the numbers were substantial to be able to carry out clinical trials. You don't have such numbers. And as I said, it's unethical to conduct a clinical trial in a place where there is no disease at the moment. And any other suggestions, I think, from the French doctors sounds and smacks of racism and past colonial, I think, thinking, as the Director General of the WHO has already said.
Now, just to look at South Africa itself.
So ethically, there's no rationale.
Looking at South Africa's approach itself, currently
yes, South Africa has got...
Please continue, Professor.
South Africa, it's on a lockdown. South Africa is on a lockdown, and it's encouraging, I think, social distancing, washing our hands, and staying away, I think, from spreading the virus. And so far, I think we have about 1,165 patients that have been infected with the coronavirus. And these numbers are not enough to conduct any clinical trials. And South Africa has got the largest number of patients with coronavirus in the continent of Africa. So I'm not sure why people are even thinking of conducting clinical trials in Africa.
Thank you very much, Professor Makgoba, for speaking to us there. Look now at some other news. The last official tally put Ivory Coast at 261 confirmed cases of coronavirus as authorities ramp up measures to prevent the spread of the disease. Not everyone is falling in line. On Sunday night, residents in Abidjan tried to destroy a coronavirus testing site. Sam Bradpiece has more.
It was here in Yopougon, one of the poorer districts of Abidjan, that residents came and tried to destroy a coronavirus testing site that was in construction, apparently fearing that their proximity to the site increased their risk of getting the coronavirus. Now, the police apparently had everything under control by around 11 p.m. local time. The following day, they appealed to the public to have trust in them. But what this incident last night shows is that as the virus spreads, and as the government tries to step up action against the spread of coronavirus, not everybody is prepared to step in line. Over the course of the weekend, 24 people were arrested for breaking curfew. And it's likely that as this virus spreads further, as the government steps up, we will quite possibly see more public pushback as we saw on Sunday night.
Sam Bradpiece there for us. Now, gunmen killed 25 soldiers in northern Mali on Monday morning. The attack happened in the region of Gao. It's still not clear who was behind the raid. However, the area has been repeatedly hit by attacks from armed jihadist groups over the years. Meanwhile, Kenya has ramped up its restrictions, adding to its dawn to dusk curfew with new travel bans in and out of Nairobi. That started on Monday night. The port city of Mombasa and the counties of Kilifi and Kwale will also see travel restrictions from Wednesday for 21 days. Most of the country's 158 confirmed cases have come from those 4 locations. And 51 of Africa's 54 countries have now reported COVID-19 cases. More than half have brought in lockdowns, curfews, or similar constraints on movement. That's made it tough for kids to get to school. Some countries have tried to work around that by broadcasting lessons on national television. Nicolas Chemin tells us more.
The classroom is empty, but this philosophy professor is still teaching. The lesson is filmed and will be broadcast on one of Burkina Faso's television channels. Like many other countries on the continent, authorities here have closed schools because of COVID-19. The videos help students revise.
On se replonge dans l'univers un peu de la philosophie et on essaie de se familiariser, bien entendu, avec les concepts philosophiques et ça maintient, ça nous permet tant soit peu d'oublier la psychose de cette maladie-là qui a contraint le monde à se confiner.
This high school student is listening carefully to the lesson but hopes to return to school as soon as possible.
J'espère que d'ici là, les conditions sanitaires vont s'améliorer et peut-être on pourra reprendre les cours afin de pouvoir continuer et terminer l'année.
In Cameroon, lessons are broadcast on national television.
J'espère que tu as déjà ton matériel de travail à côté.
Many African countries have started this system in recent days. Among them are Ivory Coast, Kenya, Libya, Morocco and Senegal.
No excuses, kids. Well, that's it, though, for Eye on Africa. Thanks for joining us. Do so again. Take care.